In this segment, we would be talking about the arthritis affecting young women. In women, the commonest form of arthritis we have is rheumatoid arthritis, which is usually seen in women in their 20s and 30s. How does this rheumatoid arthritis start? It usually starts as a pain in the finger, a stiffness of the fingers early morning when they wake up from the bed, or a pain in the feet, especially your forefeet, your toes. Over time, when they start moving, the pain eases out, the stiffness comes out, and they think that it's something related to their food, their diet, but it is not so always. Of course, I do agree that vitamin D deficiency also causes this sort of pains, and vitamin D deficiency is on the rise, and it's nearly epidemic in the UAE. So you can go to your doctor, get it checked. So vitamin D, if it's low, you can take it and you can come out of it. But the most important thing is ruling out an inflammatory arthritis, the common one, the rheumatoid arthritis. So you can go to your rheumatologist or the internist, who would refer you to your rheumatologist. What would they do? They would examine you, they would check you, they would quantify your disease clinically based on the examination, which the joints affected, the number of joints affected, and what stage of the disease. Besides that, they would do some more special investigations, special tests, the common ones being the rheumatoid factor and the anti-CCP antibodies, and they would identify your disease. So if you go to them early, there is a chance of complete cure also. So never ignore these sort of joint pains. Attend the rheumatologist at the earliest and come back to normal. There is another group of illnesses which are also common in young women called the systemic connective tissue disease, which includes diseases like lupus, where besides the inflammation of the joints, you can have inflammation of the other areas of the body like the skin or the lungs. So never ignore your joint pains. Attend to the doctor at the earliest, more the specialist. Once we diagnose it, then the treatment starts. There is a lot of counseling about the drugs which we commonly use for these diseases, because the aim here is to suppress the inflammation. So, and these drugs are referred to as the DMARDs, or the disease modifying anti-rheumatic drugs. There are more than 25 of them based on your disease, the gravity of your disease, the stage, the age of your disease, and the involvement, like whether it's confined to the joint or the other organs. The doctor would decide the right treatment. So when you are on these medications, or you have to go on regular follow-up to know whether the diseases are getting along well with your body. There's no issue with tolerance of the drug. So a regular follow-up is mandatory. Stay active, have a balanced diet, limit your stress for a healthy joint life. Thank you.